Stop! That's the wrong diagnosis! The old man's voice cut through the chaos of the emergency room. Dr. Sarah Chen, 29 years old, barely glanced up from her tablet. "Sir, please stay in the waiting area. We're handling this." William Hayes, 79, stood in his worn jacket and faded jeans, watching as the young resident prepared to inject a patient with medication that would kill him in less than 3 minutes. What nobody in that ER knew was that William had performed over 2,000 emergency surgeries under enemy fire in Vietnam, and he'd just spotted a misdiagnosis that was about to turn fatal. But in exactly 4 minutes, Chief Surgeon Dr. Robert Castellano would walk through those doors, and everything would change. William Hayes lived in a modest 2-bedroom house in Portland, Oregon. The house had a small garden where he grew tomatoes every summer, a front porch with 2 rocking chairs, and a garage filled with old medical textbooks he couldn't bring himself to throw away. At 79, his hair had gone completely white, his hands bore the slight tremor of age, but his mind remained as sharp as the day he'd graduated from medical school in 1969. Most of his neighbors knew him as Bill the paramedic, a retired ambulance driver who'd spent 40 years responding to emergencies across the city. They didn't know the full story. They didn't know about the 15 years he'd spent as a Navy medical officer, serving 2 tours in Vietnam, 1 in the Gulf War. They didn't know about the field hospitals he'd run, the lives he'd saved under impossible conditions, the commendations that sat in a box in his closet, never displayed. William had made peace with anonymity. When you've held dying soldiers in your arms, when you've performed emergency thoracotomies with nothing but a scalpel and prayer, civilian recognition seems less important. He'd done his job. He'd come home. He'd continued saving lives as a paramedic. That was enough. Until today. His granddaughter, Emma, 17 years old and the light of his life, had been admitted to St. Vincent's Medical Center 3 hours ago for an emergency appendectomy. The surgery was routine, low risk. William had driven in from his house the moment his daughter called. He'd been sitting in the surgical waiting area on the 4th floor, reading a newspaper, checking his watch every few minutes. The surgery was supposed to take 90 minutes. It had been 2 hours and 40 minutes. William wasn't worried yet. Surgeries ran long all the time. But he'd decided to stretch his legs, maybe grab a coffee from the cafeteria. He took the elevator down to the 1st floor and was walking past the emergency room entrance when he heard it. The sound of organized chaos, voices calling out orders, the rapid beeping of monitors, the metallic clatter of equipment being moved quickly. Instinct pulled him toward the sound. William stopped at the entrance to the ER trauma bay. Through the glass partition, he could see the scene. Clearly, a man in his early 40s lying on a gurney, face pale and slick with sweat, breathing in short, desperate gasps. His chest rose and fell unevenly, one side moving, the other oddly still. 3 medical professionals surrounded him, a nurse adjusting an oxygen mask, a young doctor, female, Asian, late 20s, reviewing something on a tablet, and a second-year resident drawing medication into a syringe. William's eyes moved across the scene, cataloging details the way he'd been trained to do 50 years ago. Patient presentation, respiratory distress, asymmetric chest movement, distended neck veins, tachycardia visible on the monitor. The young doctor spoke. "Suspected cardiac event. Prepare epinephrine, 1 milligram of E-push." William's blood ran cold. That wasn't a cardiac event. That was a tension pneumothorax, a collapsed lung with air trapped in the chest cavity, building pressure, compressing the heart and major vessels. If they gave him epinephrine, a drug that increases heart rate and blood pressure, the pressure would spike. The patient would go into cardiac arrest. He'd die. William pushed through the ER doors without thinking. "Stop, that's the wrong diagnosis." Dr. Sarah Chen looked up from her tablet, irritation flashing across her face. She'd been on shift for 11 hours. She was exhausted, and now some random old man was interrupting a critical case. "Sir, please stay in the waiting area. We're handling this." "You're about to kill him," William said, his voice steady but urgent. Sarah's jaw tightened. "Excuse me. That's not a heart attack, it's a tension pneumothorax. If you give him EPI, you'll spike his blood pressure and collapse his cardiovascular system." The nurse glanced between Sarah and William, uncertain. Sarah stepped toward William. "Sir, I don't know who you are, but you need to leave. Now." Look at his chest, William insisted. Left side isn't moving. Neck veins are distended. Trachea is deviated to the right. Classic presentation. Sarah's face flushed. I've reviewed his symptoms. He came in with chest pain and shortness of breath. That's a cardiac event until proven otherwise. It's proven otherwise right now if you just look at him. The resident holding the syringe hesitated. Dr. Chen, Sarah turned to him sharply. Administer the epinephrine. Don't, William said. Security, Sarah called out. A hospital security guard, young, heavy-set, radio clipped to his belt, appeared at the trauma bay entrance. Everything okay here, Doc? This man is interfering with patient care. Please escort him out. The guard approached William. Sir, I'm going to need you to come with me. William didn't move. His eyes stayed locked on the patient. He needs a needle decompression, 14-gauge needle, second intercostal space, midclavicular line. You do that, he'll stabilize immediately. Sarah's voice was ice. Remove him, now. The guard took William's arm. William allowed himself to be led away, but his eyes never left the trauma bay. He watched as the resident injected the epinephrine. He watched as the patient's body jerked. He watched as the monitors began screaming. He's crashing, the nurse shouted. Sarah's confidence shattered in an instant. What? No! Get the crash cart! The patient's blood pressure spiked, then plummeted. His already compromised cardiovascular system, crushed by the pressure in his chest, couldn't handle the additional strain. His heart rhythm spiraled into ventricular fibrillation. Start compressions, Sarah yelled. Nurses swarmed. Someone brought the defibrillator. Another called for the attending physician. William stood 15 feet away, held back by the security guard, watching a preventable death unfold in real time. And then, a voice from behind. What the hell's going on here? Everyone turned. Dr. Robert Castellano stood in the ER entrance. He was 62, broad-shouldered, with silver hair, and the commanding presence of someone who'd spent 4 decades in operating rooms. He wore surgical scrubs and still had his mask hanging around his neck. He'd clearly just come from surgery. Dr. Castellano, Sarah stammered, we have a patient in cardiac arrest. I can see that. Castellano's eyes swept the scene. Then they landed on William, still held by the security guard. His expression changed. Billy. William met his gaze. Hello, Rob. Castellano walked straight past Sarah, past the nurses, past the crash cart, and stopped in front of William. Billy Hayes, my God, I heard you'd retired. I did, 20 years ago. Castellano turned to the security guard. Let him go. Sir, Dr. Chen said, I don't care what Dr. Chen said. Let him go. Now. The guard released William's arm and stepped back. Castellano turned to the trauma bay. What's the patient's presentation? Sarah, still rattled, tried to regain control. Male, 43, chest pain and respiratory distress. We administered epinephrine for suspected MI. And he arrested immediately after? Castellano interrupted. Yes, but... Castellano walked to the patient, now surrounded by medical staff performing CPR. He looked at the monitors, looked at the patient's chest, looked at the neck veins. Stop compressions, he ordered. Sir? A nurse questioned. Stop, now. The compressions halted. Castellano leaned over the patient, his experienced eyes taking in every detail William had seen 5 minutes earlier. This isn't a cardiac event, Castellano said. It's a tension pneumothorax. Someone get me a 14-gauge needle. Now. A nurse scrambled. Castellano turned to William. You tried to tell them? William nodded. And they didn't listen? No. Castellano's jaw clenched. He turned to Sarah. Dr. Chen, did this man attempt to inform you of the correct diagnosis? Sarah's face had gone pale. He said something, but I thought... You thought what? That a random stranger wandered into your ER and decided to play doctor? I didn't. Know who he was? That's the problem, doctor. You didn't ask. The nurse returned with the needle. Castellano positioned it carefully over the patient's chest, second intercostal space, midclavicular line, exactly where William had described, and inserted it. A hiss of air released immediately. The patient's chest wall moved. The pressure equalized. Within seconds, the monitors began stabilizing. Heart rate normalized. Blood pressure returned. Resume oxygen and monitor vitals, Castellano ordered. Get a chest tube kit ready. We'll need to place a thoracostomy. He turned back to William. You saved his life. Again. I tried to, William said quietly. Castellano looked at Sarah. Dr. Chen, do you know who this man is? Sarah shook her head, still in shock. This is Dr. William Hayes, Former Chief of Naval Emergency Medicine, he served 15 years in combat zones, performed over 2,000 emergency surgeries, and trained half the trauma surgeons currently working on the West Coast. If Dr. Hayes tells you you're wrong, you're wrong. Sarah stared at William. I didn't know. You didn't ask, William said, not unkindly. You saw an old man and assumed I was confused. Castellano crossed his arms. Dr. Chen, you'll be writing a full incident report. You'll also be undergoing remedial training in diagnostic assessment and patient communication. Do you understand? Yes, sir. Good. Now go check on your patient. Sarah walked back to the trauma bay, her hands shaking. Castellano turned to William, his expression softening. Billy, I can't believe it's you. How long has it been? 23 years. You were a resident at County. And you were the attending who taught me how to actually think in an emergency. Castellano smiled. I still use your protocols. Good. They work. What are you doing here? My granddaughter's in surgery upstairs, appendectomy. She's in good hands. Martinez is on call today. Excellent surgeon. Castellano paused. Listen, I'm sorry about what just happened. That should never have occurred. She's young, overconfident. I was the same way once. You were never that arrogant. William smiled faintly. I was. You just weren't around to see it. Castellano glanced back at the trauma bay, where Sarah was now assisting with the chest tube placement. She'll learn from this. Painful lesson, but necessary. I hope so. Come on, let me buy you a coffee while you wait for news on your granddaughter. They walked together to the hospital cafeteria. Over weak coffee and stale pastries, they talked. About old cases, old colleagues, the changes in emergency medicine over the past 2 decades. You know, Castellano said, we could use someone like you here, consulting work, teaching residents. They need to learn from people who've actually been in the field. William shook his head. I'm retired, Rob. I've earned my rocking chair. Have you, or are you just hiding? William looked at him. What's that supposed to mean? You spent 50 years saving lives, and now you're growing tomatoes. Don't get me wrong, tomatoes are great, but you've still got a lot to give. I'm 79 years old, and you just diagnosed a tension pneumothorax faster than a resident with access to every diagnostic tool modern medicine can offer. Age doesn't erase experience, Billy. It refines it. William didn't respond. He stared into his coffee, thinking. An hour later, a nurse found him in the waiting area. Mr. Hayes, your granddaughter's out of surgery. Everything went perfectly. She's in recovery now. Relief washed over him. Thank you. Can I see her? In about 30 minutes. She's still waking up. William nodded. The nurse left. He sat back down, feeling the weight of the day settling on his shoulders. A few minutes later, Dr. Sarah Chen appeared. She looked exhausted and humbled. She sat down in the chair next to him. Dr. Hayes, I owe you an apology. William looked at her. You don't owe me anything. Yes, I do. I dismissed you. I didn't listen. And because of that, a patient almost died. But he didn't. Only because Dr. Castellano arrived in time. If he hadn't, she trailed off, the weight of that reality crushing. William spoke gently. Dr. Chen, can I tell you something? Please. In 1971, I was a young Navy medical officer stationed at a field hospital outside Da Nang. We got a soldier brought in, gunshot wound to the chest. I was certain it was a hemothorax. I was so certain I didn't listen when a senior corpsman suggested it might be a tension pneumothorax. I gave the wrong treatment. The soldier arrested. My commanding officer had to step in and fix my mistake. Sarah looked at him, surprised. The soldier survived, William continued, but I learned something that day that changed my entire career. Pride kills patients. Humility saves them. You're not a bad doctor, Dr. Chen. You're a young doctor who just learned the most important lesson in medicine. Sarah's eyes filled with tears. I'm so sorry. Don't apologize to me. Apologize to your patient, and then make sure you never make this mistake again. She nodded, wiping her eyes. Thank you, Dr. Hayes. You're welcome. Sarah stood and walked back toward the ER. William watched her go, remembering the young officer he'd once been. Arrogant, overconfident, certain he knew everything. Medicine had humbled him, time had humbled him, and now, in his twilight years, he realized that maybe Castellano was right. Maybe he did still have something to give. 2 weeks later, William received a formal letter from St. Vincent's Medical Center, an invitation to join their teaching staff as a consultant in emergency medicine. Part-time, flexible hours, no pressure. He sat on his front porch, letter in hand, looking out at his garden. The tomatoes were doing well this year. But maybe, just maybe, there was room for something more. William picked up his phone and dialed Castellano's number. "Rob? It's Billy Hayes. About that consulting position. I'm interested." On the other end of the line, Castellano laughed. "I knew you'd come around. When can you start?" "How about Monday?" "Perfect. Welcome back, Dr. Hayes." William hung up and smiled. 79 years old, and he was just getting started again. If you enjoyed this story, leave a like and subscribe to never miss powerful stories about the heroes among us.